Uganda has today reported 5 new cases of COVID-19. These include an 8-month-old infant in Iganga district and 2 of the 6 Chinese nationals arrested as they tried to leave the country through Zomba district last week.
The first is a 63-year-old Ugandan male, a resident of Najanankumbi, who traveled from Germany and is currently under quarantine. He presented with high fever, cough, sore throat, and shortness of breath. That is during the time of quarantine. The second case is a 57-year-old Ugandan male, a resident and businessman in salt trade in Adjumani. He presented with sore throat, difficulty in breathing. There's no history of travel abroad or even contact with anybody who had traveled abroad. The third case is actually an 8-month-old baby, a Ugandan resident in Iganga, whose father traveled from Kenya, Kisumu in Kenya, about a week earlier. Now, the 2 other cases were 2 Chinese who traveled from Guangzhou and Linyago. I think Linyago is another city in China, who have been currently under quarantine. All the previously confirmed cases, the 9 cases, are in a stable condition and are doing well, and they are feeding.
In an effort to reduce the burden on Kampala, the ministry has now decentralized the process of handling COVID-19 cases.
All regional referral hospitals have been directed to avail space for at least 20 patients of COVID, and we are going to provide them with adequate personal protective equipment, which includes part of what we have had from our partners.
Dr Mwebesa says they are planning an institutional quarantine for 3 members of parliament who were suspended from the House by the Speaker with immediate effect. The trio had also recently travelled out of the country.
Can give them a list of the hotels. We have about 16 hotels where this quarantine is taking place. They can choose a hotel of their choice, depending on what they prefer and what they can afford. But with immediate effect, they should go.
The health ministry says the threat of the COVID-19 outbreak in the country is very high, and what worries them is a case that cannot be linked to a positive or a travel.
We had not anticipated this quick increase of cases. We had our plan was to detect and contain, which is still the plan, but we shall, within today and tomorrow, we shall have explained why these cases are scattered like this.
Walter Mwesije, NTV.